Hi, welcome back to Medicare Mondays. Today's session is being pre-recorded. Today's session is about the Medicare Cost Savings Programs. Let's begin with the Medicare Savings Programs and what they are. Medicare Savings Programs are state programs that help cover your Medicare costs. To qualify for the MSP, you must meet your state's income and asset limits. The baseline federal income and asset limits for each MSP program. Most states use these limits, but some states have different guidelines, such as different income limits or not imposing asset limits. You should consider applying for an MSP even if you are over the limit, because some income and assets are counted toward the limits, are not counted toward the limits. There are three main programs, each with different benefits and eligibility requirements. The first program is the Medicare Savings Program. This has three components: a QIMBY, a second one SLIMBY, and a third one QI. A QIMBY helps pay for Part A and Part B premiums. It has an individual guideline and a couple guideline, and it does impose asset limits. The Specified Low-Income Medicare Beneficiary, SLIMBY, helps pay for the Medicare Part B premium. It has individual and couple income limits and asset limits. And the third one is called the QI program, Qualified Individual. It helps pay for the Part B premium. It also has an individual and couple income limit and asset limit. An MSP, other benefits, rights, and protections. If you enroll into an MSP, you will automatically get extra help. The federal program that helps pay for your Medicare prescription drug Part D plans costs. The MSP allows you to enroll into Medicare outside of the regular enrollment periods. If you have a late enrollment penalty, the MSP can help eliminate that. If you are enrolled into the QIMBY, MSP, providers who accept original Medicare or who are in network for your Medicare Advantage plan cannot bill you for any Medicare cost sharing. This includes deductibles, co-payments, and co-insurances for all Medicare covered services. If you have the QIMBY program and your provider bills you for these services, let them know that you have this program and that you should not be billed. Note that some states may impose small Medicaid copays for Medicare covered services. How should you apply for the MSP program? You can file an application at your local Department of Human Services or by visiting www.dhs.ri.gov and go to their premium payment application form. You can contact a benefit enrollment counselor at the point, 401-462-4444, or you can contact the State Health Insurance Assistance Line at 1-888-884-8721. Please note, it may take up to 3 months to stop seeing your Medicare Part B premiums be deducted from your Social Security check. You will get it the month after you apply, and it usually is dated to the month after application is received. Another program is called the Extra Help Program. The Extra Help Program is a federal program that helps pay for most of the out-of-pocket costs of Medicare prescription drug coverage. If you have Medicaid and an MSP or receive supplemental security income, you will automatically be enrolled into Extra Help. If you are not enrolled into these programs, you must apply directly and meet the eligibility requirements below. To apply for Extra Help, you should visit www.ssa.gov Medicare Part D Extra Help Program. Or you can contact our benefit enrollment counselor at the point 401-462-4444, or you can contact the state health insurance program 1-888-884-8721. A couple of other assistance programs that we know of would be the State Pharmaceutical Assistance Program, also known as an SPAP. Many states offer SPAPs to help residents pay for prescription drugs. Each program works differently and has different requirements for eligibility. To learn if your state has an SPAP or find out if you qualify, contact your SHIP. The Rhode Island SPAP is called Rhode Island Pharmaceutical Assistance to the Elderly Program. The RIPE program assists with medications purchased during the deductible stage of the Part D. It will help the individual's Part D plan if it does not cover medication, provided that it is on the RIPE formulary. Below is the income guidelines for Rhode Island RIPE. How to apply for the RIPE program? You can apply by completing the application and submitting to the Rhode Island Office of Healthy Aging at www.oha.ri.gov. Look under the Health Insurance Coaching and Drug Cost Assistance. Or you can contact our State Health Insurance Program line for further assistance, 1-888-884-8721. Another extra help program is called Medicaid. Medicaid people can be eligible for both Medicare and Medicaid. Medicaid can cover services that Medicare does not, such as long-term care. It can also pay secondary to Medicare, picking up Medicare's out-of-pocket costs like co-pays or co-insurances. Generally, your income and assets must be below a certain amount to qualify, but this amount varies from state to state and from program to program. You can contact the Benefits Enrollment Counselor at 401-462-4444 or the State Health Insurance Program at 1-888-884-8721. Other programs of help that would be of interest to you would be facilities that may offer care at a reduced cost. Human Resources and Service Administration facilities, HRSAs. HRSA facilities may also be called federally qualified health centers. Hundreds of these government-funded health centers around the country provide medical care regardless of your ability to pay. Another program is called the Hill-Burton program. The Hill-Burton program offers free or reduced cost care to Hill-Burton facilities. Most states have the Hill-Burton program. Services that are fully covered by any other types of insurance like Medicare or Medicaid, you would not be eligible for the Hill-Burton coverage. Eligibility for the Hill-Burton program is based on your income and family size. To apply, call the Admissions, Business, or Patient Account Office at a Hill-Burton facility. How to report Medicare fraud. If you continue to have problems with a provider billing you, Medicare statements, or medications, call your local Senior Medicare Patrol for assistance. Your SMP can help and report the potential fraud to the correct authorities. Rhode Island's SMP contact is 1-888-884-8721. If you need further assistance with any of these programs that we discussed, we have several agencies that could help you. We have Johnston Senior Center, West Bay Community Action Agency, South Kingstown Senior Center, Westerly Senior Center, The Point, East Bay Community Action Agency, Leon Matthews Senior Center, Progresso Latino, Child and Family Services of Newport County, Edward King House, Rhode Island SMP, Main Line. Thank you for attending. My name is Kim Timpson, and along with my colleague Jennifer Riaz, we help oversee the SHIP and SMP program.